Hi, my name is Karen from Mother Earth Pillows, and I'd like to just demonstrate a few ways that you can use the heated flex pillows that are very effective for pain from sickle cell and other types of pain, joint pain, abdominal, deep tissue pain, or rib cage pain. So I'm just going to show you a few ways that you can use it. Drape it over the client, over the patient. And you're doing nice, long, sustained shearing compressions. It's actually pulling the tissue up over the rib cage. So you're affecting a lot of different muscle attachments, tendons, and all the way down to the periosteum. So depending on how much pressure you use, is actually a very soothing. And have your client deep breathe, or your patient deep breathe. For abdominal pain, you can roll right along the ASIS and along the diaphragm, the lower ribs of the chest wall. And it doesn't cause pain. You can work down that whole thigh, the IT band, over the hip. The pin and stretch that I was talking about. And of course it depends on the area that you're working on, but it's simply using the heat to warm the tissue and using a counter pressure to compress and hold the tissue, and then do a stretch with the end of the other part of the extremity. So I can actually work over the knee by just using the foot. And again, this is not a lot of depth. You pace it. If you're having a little discomfort, slow down, decrease the pressure, the weight that you're putting behind it, and then ask your client to take a nice deep breath, and then exhale. And that's giving them a chance to get more oxygenation into their system also. Excellent for joint pain. Again, you're increasing the mobility, decreasing the pain, increasing the circulation. The heat relaxes the vascular structures of the muscle and expands the blood vessel. So it's a gentle way to do this. Now, a couple of other, we come up here to the top of the table. I'm going to turn around. This is the one I sent you, Laura, and this can be used too. So you can use it even on a shoulder. So I'm pinning here and letting the patient's arm do the stretching to their degree of ability. And if I want to hold it, I can actually work on the chest wall and let the stretching be done by just extending and rotating the arm. So it's compress. If I want to get in the or actually into the teres area, the lats, the serratus. Can you bring your hand up? Take a deep breath, and then exhale and pull your elbow away from me. And I'm compressing and kind of scooping into that wonderful little latissimus shelf. So you're affecting the ribs in this area too. So this is about it. You can apply the same principles to the arm by just using this to use as a counter pressure. It's a pin and stretch technique. So again, so depending where they're having pain. And this is something that can be taught to the parents. There you go.